All right, good evening, everybody. I think we're going to begin. It's about 5 minutes after, and I'm going to try to juggle, letting people in the waiting room and the G chat. Feel free to, or the Zoom chat. Feel free to chat me questions if they come up. I do have about a dozen questions that came in through the emails prior to this. I believe you have the ability to unmute yourself. Is that right? If you do, feel free to interrupt me too. I want this, if it has to be or if it can be, kind of back and forth. So I think I just saw some people unmute themselves. So it looks like you can. Feel free to do that again throughout the chat. Interrupt me if you need to. Type out a chat if, and I can do some Q&A at the end anyhow. We did this back in, I forget, June or July. It was, we did two separate chats, Zooms rather, and had pretty good attendance, about 40 or so people. We had about 30 people RSVP'd, so just trying to see if a few more jump in. But I'm joined in the room with most of the department head team, Julie, Samantha, Nell. I know John, Havey, Michaela are on Zoom, and a couple others. So we're all on the same page. And kind of the purpose of this is kind of to catch up, see where we've come in the past 8 months or so, talk about what's ahead. I know, I'm getting counts just like a lot of you are with cases in Massachusetts, and they, of course, are on the rise, and kind of talk about our visitation policies, our protocols internally, talk about testing, talk about the holidays. I'm getting ahead of myself, which I tend to do. I do have an agenda, which I will flip to now, and there it is. So let me move some of these Zoom things. What happens when COVID is in the community? A lot of this information kind of went out in the letters. I know the letters are getting sent now weekly on Thursdays, which will continue indefinitely into the spring. But it did talk a little bit about level 1, 2, 3. I want to touch on those. That's a big section of this. Talk about family visitation, protocols, logistics, timing, using the Calendly app. How many visits a day? I know the app is filling up, so I do want to touch on that a little bit. On-site testing, I was hoping to have a little bit more information at this time, but we are working with our ownership group and our management company to work out a third-party testing program at Cornerstone. We are piloting it at one of our sister communities. It went really well. It's mandatory for associates, and then it is working with families to discuss resident testing, very similar to when we had the National Guard come into the community back in April and May. The testing of residents is helpful for our staff, and of course for families to know if it's safe, if we need to use precautions, if we need to use full PPE, if visitors would be allowed or not. So anyhow, I will have a lot more detailed information coming on testing, but we're getting close to being able to do it in our community. I'm guessing it's going to be bi-weekly, but again, I'll have more information to come. I do want to talk about Thanksgiving holiday, December holidays, what you should do, what you want to do, what you can do. Obviously, it is November 12th, and these things can change very quickly. And we'll communicate if there's any changes from the state level or from the Executive Office of Elder Affairs or at the community with COVID. You're going to know about it very soon after my team's aware of it. And then I just want to talk a little bit about the associates, the COVID fund, again, thank you, and talk a little bit about the holidays. And then I will open it up for any discussion, your thoughts, your ideas. We're happy to listen and make changes when appropriate. I think We come up with different protocols with our COVID team at our corporate office. We look at what the state is putting out for best practices, guidances, or regulations. And then we try to do what's best with the community. Each community offers different abilities or inabilities for visitation, for locations for visits. So we're trying to make changes that work best for the community. So that's my agenda. I do want to hop in to what happens when COVID is in the community. And I certainly hope this doesn't come as a surprise to anybody. But on Friday, we did learn of our first case of COVID since May in the community. It was an assisted living resident. It is an assisted living resident. At the moment, they remain in the community in quarantine. It's isolated at this moment. We've had no new cases. I believe I sent out a letter on Tuesday, and it's Thursday, and there has been no new cases since that date. I think I'll repeat this. It's not really on my slide, of course, but if your loved one is symptomatic or tests positive or has close contact, we believe you will get a call ahead of an email or a text message going out. You will be aware of the situation prior to the whole community being notified of a change in level. So I don't want you guessing or thinking, is it my mom or dad or loved one? You'll know about that as soon as we know about it and prior to a community-wide notification going out. And with that being said, on the other side, the reason we were able to really isolate this was because of great communication from this family and the healthcare providers about a possible close contact. And we took guidance from the primary care and the Board of Health on what to do in this situation. And that's why we believe this situation has been isolated. So it works both ways. I know everybody on this call and all of our families are doing what they can and what's best for the residents and their safety. I appreciate that. And so let's continue to kind of work together to support them. So here's the levels. More or less, we've been in level 1 since opening up to visitors in the summer. Level 1 is no active cases in the community. There is no residents or associates who are suspected or confirmed of positive. Our regular visitor schedule is in place. We ask that you pre-schedule these visits using the app. I will, or the website, the Calendly app. I will talk a little bit about that in a moment. And I'll go into detail on where these visits can happen, but level 1 means you can visit in the community, not in the dining room, not in the piano lounge, not up in the pub, but in the apartment or outdoors or in a designated spot, which I'll go into more details on where that designated spot is. So in apartment, outside, or in the designated spot. At all times, we ask masks to be worn and social distancing to be adhered to. You'll see that that is a common pattern amongst these slides, that we just ask that you wear the masks whenever you're in the community. Our staff, we have a policy on masks, and they need to and should be wearing masks at all times. We ask that families do the same. I can tell you, and if you've been here for a visit, our residents have challenges with wearing masks. I have meetings, we do reminders, we go around telling people to cover their mask. You see masks at their chin. You see people come down without any mask. You see masks dropped on the ground. Do your best to protect yourselves and others when you're here to wear a mask. We'll keep working on our residents. If you can just do your best to keep reminding your loved one, I appreciate it. Level 1, no active cases. We'll have in-apartment visits. That's the big takeaway. Throughout all these levels, you'll note at the bottom, it says essential visitors are able to visit. That's compassionate care visits, end-of-life hospice visits, nurse practitioners, medical doctors, private duty caregivers, I'll talk about in a minute, PT, OT, speech, therapeutic programming, social workers, etc. They are throughout all levels, even when there's no visitors allowed, they are considered medically essential visitors, all these people. So that will continue throughout all 3 levels. I'm going to continue. We can jump back, or maybe I won't continue. Does anybody have any questions about level 1? If not, I'll go to level 2, then level 3, and then we can kind of circle back on any concerns or questions. Level 2 is, we do have a positive case in the community. It is isolated. We are currently in this level 2. If we have a positive case of COVID, but exposure is minimal, the case is isolated, or they're not in the community, visitation will continue, but these are the options. Outdoor visits are permitted. We got very lucky with the weekend we just had, and last week a little bit, but it seems to be turning. Outdoor visits are the front areas. We have a couple different benches, seating areas set up. Outdoor visits will now include the patios. It will include the compass patio, and it will include the traditional patio. But I don't see many more outdoor visits happening. They will not be in the apartments, neither compass or traditional, but we will be designating the first floor cafe. We have partitioned the cafe off. We have a curtain. We will check in the family member at the front, and then have them walk around to the cafe entrance from the outside, and we will we'll have the resident be brought down through the curtain, more or less. We trialed this a little bit this week with the rainy weather. It's worked pretty well. We're going to disinfect in between uses. We ask that people try to keep these between 30 and 45 minutes, especially if we've just opened up the app to ask to let for later visitation and more visitation. So we just ask that everybody is flexible and supportive and tries to be on time, and we'll do our best to get the resident into the space in time. So level 2, only outdoor visits or cafe visits will be allowed. No apartment visits. We're going to try to limit the people in the elevators, in the hallways, in the Compass neighborhood, and we're going to stay in this for 14 days and go back to level 1 once we have no new confirmed cases. As of now, let somebody in, excuse me. As of right now, we are in this level 2 until the 20th, which is a week from tomorrow, Friday. So we're in level 2 for 14 days. That's the 6th of November till the 20th of November. So that's level 2. Again, essential visitors will be allowed in the community, and that includes compassionate care, end-of-life, hospice, etc. For any families on the Zoom that has private duty caregivers, it was something that became challenging back in the spring with some families share private duty caregivers. Some private duty caregivers became sick themselves. Some chose not to work anymore. I ask that you talk to your family, talk to us if needed, try to figure out backup plans if at all possible. I know in the spring we had families have to kind of help out with some private duty care, and it was certainly much appreciated. But they are essential. We know they help so much in the community, but we're going to need the family support with kind of backfilling some of those positions. There was a question that came in about Psychiatrist being an essential visitor, absolutely. A psychiatrist is, specifically the visiting one, is essential. With that said, I know some of the medical professionals have kind of made changes. I know we had challenges getting the podiatrist back in here. We had challenges, and still the geriatric psychiatrist, she's welcome, they're welcome, but some make personal choices not to do that. So we're trying to support with Zoom calls or others. And with that being said, if there's another professional, your private physician, a specialist, a psychiatrist that you can coordinate care with, they're medically essential. You just need to let us know that, or we ask that you let us know that they're coming to the community. So, but that's a good question. Level 3 is we have more than one isolated case of COVID-19. There are multiple positive cases in the community, related or unrelated to each other. All non-essential visitation will be suspended. We're not going to have in apartment visits, we are not going to have cafe visits, we're not going to have outdoor visits. The level will continue until the community has not had a confirmed COVID case for 14 days. So that's level 3. Essential visits are still, essential visitors are still welcome in the community. So those are the 3 levels. I'll go through a little bit more detail on when you're in the community at one of the first 2 levels, where to go, what to do, how it works. But those are level 1, 2, 3. We're in level 2 currently, hoping to go back to level 1 on November 20th, which is 14 days from the new case of COVID. Any questions? Let's see, here's a good question. Any restrictions on residents leaving the community in level 2 or 3? No, that is a good question. We'll talk about the holidays. What we're asking in the letter I sent out, I think at the end of October, was to try to limit residents leaving the community to medical essential needs. But you have the right to make decisions as a family on what is medically essential, or you have the right to make your own choices. Residents have the right to leave Cornerstone. I want to make that clear. We just ask that you be careful. The decisions you make with your loved one affect the 90 people that live here, and affect the 100 people that work here, and affect the other 400 family members that have a loved one here. So be careful. Make smart decisions. We'll do our best to support you in whatever decision that is. But even if we're in level 3 or level 2, residents can leave the community. Good question. I'm going to continue. Feel free to unmute if you'd like, or the chat is working pretty well. So either way, I'll continue and we can circle back at the end if needed. Protocols. So in apartment visits, when we're in level 1, we ask that there's a 2 visitor maximum. We ask that they're from the same household. I'll talk a minute about the app. The Calendly app, we've just made some changes. We've added hours. I've gotten many calls, emails about the app filling up when we were doing in-apartment visits. We were trying to manage schedules, the programming, activities, dining, making sure there was breaks for the residents to eat, etc. What we've done is we've opened up the visits. The last visit can be scheduled at 6:15 and go till 7 o'clock. The first visit is at 10 a.m. The state guideline is that the visits have to be at minimum 45 minutes in length. So we've made those changes. We've made the changes on the websites. We've made the changes on the calendar app. Please do your best to follow this app, plan ahead, schedule ahead. I know by making these changes, a lot of openings, a lot of spots opened up. So we just ask that you do your best to follow the calendar. So that's level 1, 2 visitors max from the same household. Outside visits, when in level 1 or level 2, we ask for a 2 visitor max from the same household. The same times apply. Please schedule in advance. Cafe visits, when in level 1 or 2, same things apply. I know it was tough getting appointments sometimes, and there'd be different siblings or children, adult children coming from different households. We're just asking for the safety of all of you to keep it to 2 from the same household at a time. And if you have a brother or sister or someone that wants to visit mom or dad as well, have them sign up separately using the app. Essential visits is level 3. Again, it's just the medically essential visitors at that time. Video calls are still available. Please email, call Julie for Compass, Nell or Michaela, Nell for Traditional, Michaela for Connected Life. I'd say email, try to plan ahead. It helps if your loved one has their own phone or iPad. I know some people have gone out and purchased phones and iPads for their loved one, even if they can't use them themselves. It helps us. So we're not sharing, Nell's not sharing her phone or a house phone with 4 different people in a day. Please schedule in advance. Try to be flexible if you're asking for video calls, just because obviously these programmers are trying to run around and schedule activities and keep people engaged as well. So those are some of the guidelines when visiting, where to visit, how to visit. When you check in, Carrie will kind of direct you if you're not sure on where you can visit, where you should visit, as far as if you should go to the cafe or to the apartment. But those are some of the guidelines right now. Another question came in, are RCAs helping those residents with confirmed cases also helping other residents? They are. We have certain protocols for anybody who's been symptomatic or, in this case, positive, where they're donning and doffing full personal protective equipment, using N95s, KN95s, gowns, gloves, goggles, hairnet, booties, only for that resident. They have hand sanitizer and then hand washing. So to answer your question, yes, there are, if we had multiple cases, we'll do our best to have an associate who's responsible for COVID positive residents. In this case, where it's isolated, it's 1 caregiver per shift assigned to this resident. It's a good question. During these visits, it sounds like a broken record. Masks required, social distancing adhered to. Please use PPE, or we're using PPE, sanitizers, masks in the resident apartments. We've had a lot of families bring in a couple bottles or cases of sanitizer just for their loved one's apartment. We've had people buy 50, 100, 150 masks for their loved one's apartments. It helps us. We have a 30-day supply and stockpile, plus we have what we use in a month. I think we go through about 5,000 masks a month. Sometimes residents get 4 or 5 a day, and it's a lot. The burn rate for some of this PPE is excessive, but your support is certainly, helpful if you can supply masks or sanitizer for apartments. We're going to continue with sanitation. We have protocols, about 30 pages of protocols, including disinfecting the entire community 3 times a day. We start early in the morning around 7 and end around 6 at the end of the day. The program directors sanitize throughout the day, and after programs, after activities, after concerts, in the dining room, they're spraying tables and chairs, etc. So we're still following some of our guidelines. The daily health screens are going to continue. I know a lot of you who visit. I know the staff get the same questions every day. It takes a couple minutes to check in sometimes. We just ask that you are patient with us. You know, poor Carrie at the front desk has to ask the same questions, 100 times a day. So we appreciate your patience through these health screenings and your patience with the visitation restrictions, etc. And back to PPE, I think they do talk about these surgical masks as being the best, I suppose. However, a lot of people do have cloth masks. If you're bringing in cloth masks, we just ask that you bring more than one, as many as 7. They get used, they do get dropped, they get dirty, and we put them through the wash with kind of other laundry as needed. But the more you have, the better for us and the safety of the residents. So that's just some of the continued guidelines. See if there's any questions. All right, let's talk a little bit about Thanksgiving. And I've put way too many words on this PowerPoint, so I apologize for that. Some of this is just cut directly out of the letter, but Thanksgiving is 2 weeks away. We're planning on the Compass neighborhood and on the traditional neighborhood a lot of fun and festivities, a full Thanksgiving feast, a buffet. However, not, the residents will be served, but it's going to have the appearance of, the full buffet, a carving station. I talked to Dennis on the traditional side, Eileen and Julie on Compass. We're going to do it right. It's going to be the turkey and all the fixings. There's going to be a carving station with ham. There's going to be salmon options. There's going to be lots of desserts. There's going to be happy hour and sangria. There's going to be a concert. We're going to have football available with, beer and wine. So we're going to try to have a fun day, probably more going on here than is going to happen at my household anyways. So I am not trying to discourage you from making your own decisions as a family, but we're trying to have a lot going on here. We'll have activities and staff to help support the residents and make sure they're having fun, to make sure they're not sitting upstairs in their apartment, missing a celebration. We're going to have a celebration here. So with that being said, if you choose to celebrate with your loved one, we will be expecting all visitors to follow state recommended guidelines. And of course, I've listed them here. It talks about, I think the state or the governor is saying no more than 10 inside at any time right now, wearing masks, social distancing, not sharing food and drinks, avoid shaking hands and hugging, all the things that holidays are for. With a lot of people traveling, with students coming home, we just ask that everybody is safe, and you make smart choices. Apparently the state guidelines even say avoid singing, dancing, and shouting. So, I just ask that people are careful. We're going to have a fun day here. and make smart choices, I guess. There's some Q&A I'm going to get to in a little bit that touches on the holidays as well, and so I'll circle back to that. And let me answer a question that came through. Thanksgiving will be well staffed. Yes, it will be well staffed. The one difference from a normal day will be that it will the dinner, we do a lunchbox delivered dinner. We go around, we get every resident's choice on what they want for dinner. There is a concert at what time? 1:45. 1:45 to about 3 o'clock. Happy hours from, I think, 3:30 to 4:30. Dinner will be passed out around 4:30 to all residents. I think we have a movie night as well. And Compass has their own programming as well. So yes, it will be well staffed. And there'll be a lot of fun things going on. All right, I think holidays continue, just to give you a little bit of a look ahead, is holiday celebrations at Cornerstone. We're not going to have our annual holiday party. We usually get a couple hundred to 300 people to show up. Obviously, that's not going to happen this year, so I apologize. A couple things we're going to try. You know, we've tried everything from, I think we did a Memorial Day parade, 4th of July celebrations. We tried the Halloween parade, it didn't work out. So we're trying to get creative with families to participate. A couple things we're going to do is a Toys for Tots drive with our staff and with families, and try to part of that is we're going to be doing some associate and resident events, the 12 days of Christmas and some other things, if you have a toy to donate. So more details to follow on that. We're also doing a holiday tree and menorah lighting outside on the patio on December 10th. We'll have kind of a station for hot chocolate or cider or something spiked maybe, along with holiday sweets. So we'll try to make it fun, something that you can come in and watch and participate in, and have the residents watch and participate as well, in place of a large party. I'll get a lot more details out to everybody when I have them. So definitely a different year for all of us, including the parties at Cornerstone. There's a question: if we want to schedule a Zoom or FaceTime with our family member on Thanksgiving, is there time that would be best? Let me talk to the programmers, figure out how that's best possible. I know running around, it depends how many we have. I think it's doable. It's just trying to figure out and schedule. I do want to talk about medical appointments too. But if you'd like to schedule a Zoom or FaceTime, reach out to me directly and we'll see how we can coordinate that. But I think it is possible, and we just have to see what the demand is and make sure we can do it safely. All right, let me go back. All right, we will talk a little bit about virtual physician and telehealth appointments. You certainly can leave for medical appointments. Residents can leave for medical appointments. They're considered essential. I would, if you're picking your loved one up for an appointment, you don't have to schedule it with us. You can call the receptionist or the nurse and say that I'm going to be picking up my mother or father at a certain time. Can they be in the lobby with their jacket, more or less, and we'll do our best to have them waiting for you. If you're going to have virtual appointments, I'm working with the nursing department. We're going to try to figure out certain dates and times that we can make sure we have available. We have a handful of nurses on staff at any one time, taking calls, dealing with events, dealing with falls, dealing with whatever happens. So sometimes it can be tough to make sure we're there for every telehealth. telehealth appointments are considered medically essential. If there was an appointment and we were having trouble staffing it, we could have a family member come in and be on this end in the community. As long as we're not in level 3, I'd be okay. I think that'd be considered medically essential for you to be there for the appointments. With that being said, I'm working with the nursing department to have more of an organized calendar and times for telehealth appointments. I think it's a great way to keep residents safe and from leaving the community. But at the same time, telehealth comes with its own issues. Scheduling, technology sometimes isn't the greatest. Residents hearing and understanding what's being said. So it's kind of a team effort with these telehealth, but there's pros and cons to both of them. And I will send out direct information on who to contact. Is it myself? Is it Samantha? Is it just the nurses directly? So we'll work with you on the telehealth. And as I receive more direction from, again, the DPH, the Board of Health, the Executive Office of Elder Affairs, I will send you updates. I am trying to stick to Thursdays. I knew we were having this Zoom call today, so I don't think the letter went out today. But I will be sending this Zoom call in a letter tomorrow, so that any family members that missed the call can watch it. However, if there is a change in the visitation level, much like we did on Friday, we will let you know as soon as possible. If we go from level 1 to level 2 to level 3, I'm not going to obviously wait till Thursday. So you'll be receiving very timely, texts and emails. And please, if your families or siblings or anybody is not getting the updates, have them text updates to our number. I think we put it in every letter, or it's at the front desk. But it's text updates to 781-821-3616. And if you don't want the updates, you can text stop at any time. So, and something to consider, we're trying to work with different companies, including Verizon, to have a Cornerstone channel, although Verizon has proven difficult. Think ahead. I know the quarantine we went through in March, April, and May, I don't see us getting back to that level of quarantine. There was pros and cons of that. Trying to keep people safe in the beginning, the unknown, but as you all know, the isolation and the quarantine had effects on every one of our residents, physical, cognitively, socially. It's, I see it, we see it, you see it. So I don't foresee us going into that level of quarantine unless somebody is positive or symptomatic or very close contacts. That's when we're going to have somebody go into their apartment for 14 days. We've seen people test negative over and over again, and then at the end of close to 10, 12, 13 days into an isolation, test positive. So this incubation period is real. We've seen it here, so we just ask that people are patient. With that being said, if your family member doesn't have a radio in their room or a TV or an iPad or books or puzzles or coloring supplies, and they like doing that, or you think they do it, we ask that you prepare for it and bring it in and set them up. We'll do our best, but it's definitely helpful if the family can kind of bring in some tools as needed. All right. I think this is, sorry. Cornerstone Associates are appreciative. I do want to continue to thank all the families. People still bring in food. They bring in desserts. They've ordered pizzas. You guys did an amazing job. I can't thank you enough, all the families. during COVID who donated to the COVID Associate Fund. We are going to be sending out a letter. We do it every November for a holiday fund, just to collect money. A lot of families ask about tips or gift cards or how to say thank you to the frontline staff. This is for the frontline staff. And every year we do send an Associate Holiday Fund letter out. You can participate if you'd like. You don't have to participate, but it goes right to the frontline workers. So we will be sending that out. I know with the COVID fund and the times, it's up to you if you'd like to participate. So you'll be getting a letter probably in the next 2 weeks with that information. So other than that, that was kind of my agenda. I do have some questions. I'm going to stop sharing my screen. I can share if I needed to. And if feel free to unmute, let me pull up some of the questions that came through, and then jump in if I didn't touch on them, or if you want to clarify, or if you have follow-up questions. Is there any way to know how many people will be staying at Cornerstone for Thanksgiving? That is a great question. We don't know that answer. What I'm asking you to do, I guess every family, is if you do choose to bring your loved one out, please let Julie know if it's a Compass resident, or Carrie know at the front desk if it's a traditional resident, by Monday the 23rd. That gives us a little time to prepare. In the dining room, it gives us time to prepare box lunches. It gives us time to prepare for the state if things change in the next 10 or 11 days. I agree, I don't want any resident to be left alone, if you will. Just with what we have planned in the day, that won't be the case. There'll be programming, there'll be meals, there'll be concerts, there'll be happy hours, there'll be a lot going on. So I don't know that number right now. I'm not sure if I will know it. From my communication and conversations with the 100 or so family members, it sounds like a lot of people are opting not to take their loved one home, but I don't have a count on that at all. There was a question about the telehealth appointments. How are we going to handle supporting in-person doctor visits? I know there's limitations in the community for visitors. I'll just clarify, any doctor appointment is medically essential, and that doctor can come into the community. If the person is positive for COVID, that's another story, but doctors are considered medically essential. Some doctors are not able to meet as often as they would like to due to lack of resources. I think with video calls, I'm working with Samantha and the nurses to figure out a good schedule for telehealth appointments, similar to how we did medical appointments on the van. We did Mondays and Thursdays. To local doctor's appointments, we might do Mondays and Thursdays for telehealth appointments or something like that. So I'll share a little bit more information. Bottom line, if you do have a telehealth appointment scheduled, please reach out to the nursing department and Samantha right now to see if they can 100% support it. And if not, we might have to ask families to support. But for the most part, we've done pretty good job at juggling the telehealth calls. Will staff make sure people who stay on Thanksgiving that are aware of all the activities? Absolutely. Absolutely. They'll be going around making sure people are coming down to the concert. And I know we have a performance in the morning. I know we have a couple different programs going on. So yes. With the resurgence of COVID, are there plans to have people quarantine when they return or leave the facility? It's a good question. If someone's going to be out of the community a long time, there's a couple of reasons they'd be out. Maybe they'd be at rehab or the hospital. We are asking that they have negative COVID tests, 2 negative COVID tests. Most hospitals and rehabs are great at that. If they're going home with family for an extended period of time, we ask that they get negative COVID tests, if possible. There's 3 reasons we are going to quarantine people, not just if they leave the facility, but if they have had close contact, we will quarantine somebody. If they are positive, we will quarantine somebody. And if they are symptomatic, cough, fever, I mean, we've had everything from upset stomach to diarrhea to loss of smell, taste. We're doing the health screening daily on those questions. We will quarantine somebody and ask that a VNA test them. So, so the question of, are there plans to have people quarantine when they return? If they leave the facility, it's only under those stipulations. There's questions about programming continuing. We are going to continue with programming. We're doing our best to keep it distant, 10 groups of 10 or fewer, masks, moving programming to the 2nd floor and the 3rd floor and the 1st floor when possible to spread out groups. We were just notified by the state we're not allowed to have live music, or singers rather, inside the building. So we're working on ways to have singers stand in the patio and courtyard area and then perform outside. We're working those details out. Obviously, this just came out on Monday or Tuesday. We can still have performers or musicians kind of thing, but singing specifically cannot happen indoors. Are there ways to continue visits when it gets colder and we can't go outside? Yeah, I'm hoping we stay in level 1 with the level 1 or level 2, so in apartment visits or the cafe for scheduled visits. So the cafe, the reason we chose it is it's accessible from the outside. It won't get a lot of foot traffic in the winter. We can section it off from the piano lounge, and it's one of the few areas we can get to from the outside for families. So yes, we're going to be using that cafe. And then there's just a question about, things in your loved one's rooms, everything from clothes to laundry to decorations to, just checking in the apartment. Communicate with us. The short answer is if we're in level 1 or level 2 or 3, we really don't want anybody going through the hallways and the elevators, going upstairs, being around people if we have COVID in the building. So communicate with us, with Samantha, with Nell, with Julie, with myself, with Tom, about anything, and we'll do our best to get back to you. We can bring things downstairs. We've packed up laundry. We've packed up summer clothes. We've changed out wreaths. We've done it all. So so the answer is reach out. If the specifically you're trying to put up holiday decorations, I'm hoping in 8 days we'll be back to level 1. You can come during your scheduled visit in the apartment and switch out things as needed at that time. So that's my thought on that piece. I think those are kind of the extent of some of the emailed questions. I don't think there's any more chats. Anybody have any questions or comments? I can try to answer here. If you'd rather reach out to me individually, send me an email, call me, stop by, I'm happy to answer personal questions or questions that have to do with your loved one individually as needed. So if anybody would like to unmute, I'm happy to answer something globally now. And if not, here's a chat. All right, thank you, thank you. I appreciate you all spending part of your evening with me. I know how busy everybody is, and I thank you guys. I do thank you all for the support of all the families. You guys have been wonderful through this all, and I think we're lucky to have such great families. A question? Is it in the chat?
Yeah.
Thank you.
If you go to level 3, residents still have activities.
Good question. If we go to level 3, will residents still have activities? The short answer is yes. Our goal this time is to isolate people who are symptomatic, to isolate people who are positive, and to isolate people who have close contact. It's going to be, we have to use our judgment. In Compass, it's particularly hard for some folks, to follow directions, mask, hygiene, distancing. Traditional, it's the same, to be honest with you. We're trying to keep small groups. I'm happy the dining room has worked out pretty well on both sides with separation 6 feet at least. I'm happy to have made it to kind of middle of November here without any cases. I'm hoping this stays isolated. I think to answer your question, activities are a huge part of why people are here. One of the biggest reasons people are here are for social reasons. So my goal is not to go anywhere close to the type of isolation that we were in April. So yes, activities will continue at this time and in the foreseeable future. All right, everybody, I hope you have a wonderful night. I will send a letter out tomorrow and have this as an attachment, just a replay of this Zoom call, and forward it to everybody that you would like to in your families and anybody who touches Cornerstone. So thank you everybody, all the managers, and have a wonderful night, okay?
Thank you.